So Jerry went through a first-line treatment. As I mentioned before, it's a standard of care, bendamustine and rituximab combination, and he responded well. But as we know about the nature of this disease, the response didn't last long, and that's why he had to look for other options. Which brings us to the discussion of second-line treatment. What are the second-line treatments in patients with follicular lymphoma? There are standard of care drugs, including combination chemotherapy like R-CHOP, which, as I mentioned before, there is significant side effects. Or you could look for novel drugs, and that is what he did. The novel agents mostly work through pathways and proteins on the surface of the cancer cells, so that you inhibit the cancer cell or destroy the cancer cell by working through inhibiting those pathways which the cancer cell depends upon. An example is a BTK or Bruton tyrosine kinase pathway. Another example is a PI3 kinase. It's a pathway which many cancer cells depend significantly for their survival. So if you cut off the PI3 kinase pathway with a medication, you should be able to cut down the growth of the cancer and kill the cancer cell, specifically the cancer cell, without affecting the normal cells. And that's the beauty of using this targeted agent. So the drug that Jerry used, the pill, is a PI3 kinase inhibitor. And unfortunately, that pill gave him some significant side effects with the liver disease. Do you remember what exactly happened? What was your symptom, Jerry, at that time?
I went in for a checkup, and the blood test revealed that the level liver enzymes, I believe, was in the thousands level, where it should have been much lower. I believe it was the night before I went into the doctor, I noticed a change in my the taste, my ability to taste food. Mm-hmm. And that progressed for the next several months until that went away. But I was immediately removed from that medication, and I spent a couple nights at Rush Hospital and observed. And it was, like I said, several months before I received normal taste of food and drink. And at that point, other than my numbers going up, I didn't have any other side effects. Mm-hmm. that I can remember. It was just the taste that was the worst.
Exactly. So what happened was, when he was put on this medication, he did have increased liver function abnormality. That means the liver was getting damaged from the medication, which is a known side effect of that drug. The PI3 kinase medications that inhibits PI3 kinase pathway can cause hepatitis or liver inflammation, colitis or inflammation of the bowel, and pneumonitis or inflammation of the lung. These are side effects. But there are several PI3 kinase inhibitors. Some of the names are idelalisib, copanlisib, duvelisib, umbrelalisib. These are all PI3 kinase inhibitors. These are all drugs that kill cancer cell by inhibiting PI3 kinase pathway. The beauty is that the side effects vary between these drugs because the pathway is inhibited based on certain parts of the molecule like delta, alpha, gamma. Depending on which part is inhibited, the side effects can vary. So that's the reason why Jerry was able to get another treatment with the same pathway inhibitor. So the treatment he is getting now is also a PI3 kinase inhibitor, but it has much less side effects on the liver as well as the lungs and the colon, and that is why he has been able to tolerate the treatment so far well. Can you tell me about experience with the current treatment?
I am currently treated 3 times a month. Every week on Wednesday I go for an infusion, and then I have 1 week off. My side effects are fairly minimal, I guess. I got a little fatigue and some gastrointestinal issues, but nothing I can't handle. Probably the biggest thing is the fact that I got to go there every week. And I'm there for about 3-4 hours. It's just every week I got to be there, and that is a little annoying at times, but that's what I got to do to treat my disease.
Yeah, thank you. So I think it is also important to note that, the point I mentioned before, that is, as a patient, you should work with your provider, whether it's a doctor or a physician assistant or nurse practitioner, and look at options at each point. When Jerry had difficulties with the first PI3 kinase inhibitor drug, we talked about the different options. But then we thought another use of another PI3 kinase would be concerning, because if it is the same class of drug, can it also cause liver dysfunction? But based on the studies and the information we had at that point, the chance of liver disease from this drug, even though it is working in the same pathway, appear to be much less. And that's why Jerry and his wife also did the research and finally said, we are willing to try that, even though there is a risk, and he tried and it did well. So I think the point, again, emphasizing that you need to work with your doctor and look at all your options and select it. In many things in life, we have to take some risk to get the benefit, and that is exactly what Jerry went through and made the correct decision. So I think what I would emphasize again is the point that as patient, you try to get as much information as possible about your disease and your options, and then work with the doctor and make that decision. Are you happy that you made that decision, at least at this point?
I am happy.
Okay.
And I hope to continue the reduction in my cancer cells. It's not gone yet, but it looks like we're going that way.
Good.